Okay. Recording. Yeah. Okay. So this presentation is about nonneoplastic diseases of the prostate, penis, and testes. When you start this question, or like if you get this question, you need to speak organ-wise, and then you further divide the pathologies of each organ into infectious and non-infectious pathologies. So first of all, we start with the infectious diseases of the penis. And when you talk about the infectious diseases, you can also further divide it into non-specific infections and specific infections. Yes, pathology is all about classification. When you start talking about non-specific infections, you talk about mainly balanitis and fournier gangrene. This is a better situation. This is a very um severe situation. Balanitis is inflammation of glands and foreskin, classic inflammation signs. Fournier gangrene is necrotizing fasciitis gangrene in the inner genital area of older men, caused mainly by Clostridium, for example. Looks like this, very necrotizing and deadly, to be honest. Okay, this is balanitis, classic inflammation signs. Prognosis of fournier gangrene is poor, fast, and deadly spread, like as mentioned. Then you talk about specific infections. Syphilis, most important. Please remember the pathogen, otherwise professors don't like it. And I know in the exam, when you're studying for the exam and such a big subject, you often tend to miss the very simpler facts and learn all the difficult stuff. And to be honest, the simpler facts are more important to the examiners than the more difficult knowledge you tend to study right before the exam. Then you talk about chancroid here, Haemophilus ducrei. I think yeah, Haemophilus ducrei. Uh, a granuloma inguinale, genital herpes is very important, and lymphogranuloma venereum. So just know one or 2 points for each. For syphilis, no more detail, of course, and you will be fine, hopefully. Um, this is how genital herpes looks like. Okay, so the non-infectious disease of the penis. First of all, we talk about the congenital malformation, hypospadias and epispadias. Hypospadias are more common. It is the failure of urethral folds to close properly, leaving the meatus in the inferior penis open. This is what hypospadia would look like in the inferior penis. You got some openings, like not all of them, of course. Like it's just like shows the percentage of the location where you're most likely to get an opening. Yeah. And common, it's 1 in 300 meters location in penile, scrotal, or in between. Yeah. Complications and fertility infections, very important. Epispadias are rare. Dislocated genital tubercle leaves the meatus in the superior shaft. So this is inferior. Epispadias are superior, and thankfully they are rare. Complications are same. Infertility infections, very important. Complications are very important. Phimosis. Okay, so phimosis is the hidden glances, small foreskin, basically cannot be retracted, and this can be congenital. Or this can be developed throughout life, like mentioned here, primary or secondary, following trauma, inflammation, or scarring. And the clinical presentation will be pain in erection and inability to retract foreskin. Um, and in the long run, it has a slight risk of penile squamous cell carcinoma because of malhygiene and chronic inflammation, and irritation. So that's about the infectious of the penis. Next we talk about, oh, why is this here? Right. Um. Okay. Yeah. Yeah, next we talk about the pathologies of the testes. First of all, we start with cryptorchidism. I'm so bad at pronouncing this word, but you know what I mean. So the testes fail to completely descend from the abdomen into the scrotum. Mostly unilateral, stuck in the inguinal canal, can be abdominal, inguinal most common, inguinal locations most common, suprascrotal, femoral, or prepenile. 1 in 100 people risk factors: premature birth, Klinefelter syndrome, testicle is atrophied, infirm, or fibrotic. Complications of fertility, germ cell tumors, mostly seminoma. Then the other pathologies of testes are testicular torsion, common in especially in kids. Uh, so it means testicle rotates on its axis on the spermatic cord, obstructing the venous drainage and innervation while still allowing arterial flow into the testes. Present in adolescents, like I said, in children, mainly like teenagers, with acute severe pain, swelling, and redness, missing cremasteric reflex. Complications: hemorrhagic infarction, so it is an emergency. Necrosis must be resolved within 6 hours surgically. It is an emergency situation. This is how it looks like. It's very obvious there's hemorrhage happening here. Okay, then we talk about inflammation of testes, orchitis, and epididymitis. Etiology is specific, non-specific, again, because we're talking about inflammation. So here you talk about bacteria mentioned here and viral mumps, especially for kids with the basic. I'm sorry. No, viral mumps would be with these basic triad, which you already know, I think: keratitis, pancreatitis, and meningitis. It doesn't affect children as the testes are not developed, but rather teenagers. So yeah, so not children but teenagers for viral mumps, orchitis. Then autoimmune, you see granulomas. Then you can have some vascular inflammation causing ischemic orchitis due to thrombosis. And most of the most important complication is infertility. Yeah, clinical signs will be fever, pain, swelling, the basic inflammatory signs, and inflammatory cells. And if it is chronic, then consider tuberculosis or syphilis. A very important slide, and the most important points which you would need with the point of view of the exam. Then next you talk about the pathological scrotal content. Here you talk about hydrocele, where the fluid accumulates between two layers of tunica vaginalis, and you divide it into some subtypes mentioned here. And if it is bloody following trauma torsion, you call it hematocele. I'm sure you already know him. Spermatocele is when you have the head of the epididymis accumulate sperm. Cystic formation is with semen. Okay, symptom is painless. So no symptom. Varicocele dilation. Okay, varicocele is important. Dilation of pampiniform plexus due to poor venous drainage. More common in the left side, anacne, indirect drainage to renal vein compared with the right side. Most common cause of infertility, so that's why I said varicocele is very important to know. And it is associated with renal cell carcinoma, renal vein tumor, poor venous drainage. Yeah, I'm teaching you guys stuff only, like, I'm teaching you the most important stuff for the exam, which you cannot miss out for this question. So please do listen and read the presentation properly. Okay, next we talk about prostate infectious diseases. We have here prostatitis, specifically specific or non-specific inflammation of prostate. Etiologies for the would be gonorrhea, chlamydia. If it's a young adult, if it's an older one, you consider following a UTI, E. coli, or Pseudomonas. You can also consider BCGitis, which is a form of prostatitis caused by BCG vaccine for tuberculosis. Clinically, what you would see is in acute, you would see dysuria and systemic signs with lower back pain, and chronic asymptomatic but can present with dysuria. Urine can be cloudy due to pus, and semen can be bloody chronically. Diagnosis, not so important, but no, I think it is. In the case of prostate, I think it is. Acute and chronic diagnosis, acute, you will see secretion. Culture shows bacteria, chronic does not. PSA can be elevated slightly. So Always check that. And then digital rectal exam is normal in chronic. Okay, remember this. And hot, boggy, tender, swollen in acute. So in chronic, it's quite normal. Your diagnosis for chronic would be very difficult. Yeah, so remember this. Okay, non-infectious pathologies of the prostate, the most important one, I think, and I think the only one which you would need for the exam of pathology is BPH, which is hyperplasia of glands and stroma, most common, very common, honestly, in the periuteral region in transitional zone. This is very important for you to know because this decides the clinical presentation of the BPH and differentiates it from the carcinoma. Okay, etiology is unknown mechanism. You can read, not important, but just know that it is the increased production of the 5-THT, which stimulates the growth. Normal process of aging, 50% over 50 years, so 90% over 90 years. So very common in older men. Clinical manifestation would be dysuria, hesitancy, weak stream, dribbling, nocturia, and frequency of increased frequency of the urine. Complications are very important. Hypertrophy and diverticular of bladder, UTI, retention, hydronephrosis. No risk of cancer. Please remember this. Don't say there's an increased risk of cancer or cancer is a complication. Don't say that, please. So BPH has no risk of cancer. Um, yeah. Diagnosis DRE, digital rectal exam, hard white nodular, ESF between 4 to 10. Treatment alpha 1 antagonist and 5-THT receptor inhibitors or resection TERP. Uh, I know diagnosis and treatment are not part of pathology, but I think for prostate it's nice to know this. Um, yeah, and that's about it. I hope you learned something and will remember these points for your exam. All the best.